Okay, number three here, pregnancy and COVID vaccine. So yes, pregnancy is one of those topics that's a big hurdle to get that population vaccinated because obviously, you know, pregnancy is very important. You don't want to mess with anything with the reproductive organs or the fetus, or if you're someone who is very desperate or had like in vitro, you don't want to mess up the entire process. But the data actually shows that vaccines are extremely safe in pregnant women and also in breastfeeding women and their babies. So a recent study done through vSafe, which is a program sponsored by the CDC, where they look at people who got the vaccine and track them through the app, and you could sign up voluntarily. They looked at about 5,000 pregnant patients in the first, second, and third trimester. And what they found is the amount of babies who were born premature, who had sustained the neonatal ICU, who had low birth weight, or death were all the same as a normal population pre-COVID. So what that says is the vaccines do not affect pregnant women or the developmental process. They also looked at the fetuses. They have any defects at birth, and all of the defects that did happen, which I believe was about 42 defects were observed. All of those coincided with what they saw pre-COVID. So that means that the vaccines do not cause any defects that we know of, and they do not cause prematurity in babies or underdevelopmental conditions. What I will say about pregnancy and vaccines is that those who are unvaccinated and pregnant and end up getting COVID anytime during the first, second, or third trimester are at a higher risk of preterm delivery, more complications in the fetus, and also a very, very high risk of dying from COVID. So you might have heard from other states that those who are pregnant and had COVID-19, they never got a chance to hold their baby because they had to go to the ICU after premature delivery, or they're stuck in the ICU and can't hold their baby because for obvious reasons. So when you are pregnant and get COVID-19, you end up being in the immunocompromised group. So which means you're at a higher risk of getting severe infection. Also, one benefit, if you do have someone who is concerned about pregnancy and breastfeeding, according to ACOG, which is the American College of Obstetrics and Gynecology, recommends getting the vaccine because one, it protects a pregnant patient from dying from COVID and getting severe infection. Two, it helps with fetal development. And three, which is the most important thing, or which is the most interesting thing to me, is that when people are breastfeeding their fetuses, the antibodies made by the mother actually transfer to the baby by drinking their breast milk. So what that means is that the baby's mouth, their esophagus, their respiratory tract, all of that is covered in COVID antibodies, which means there's extra protection in case COVID does somehow fly into the baby's mouth. The antibodies can actually deactivate the COVID before it causes any symptoms in the baby. So you're actually doing a service to your baby if you do get vaccinated because they've shown positives when you breastfeed. And if someone asks about breastfeeding after the COVID vaccine, you don't need to what they call pump and dump. So they would pump their breast milk after a certain time and then feed their baby the remaining breast milk. You don't need to do that because, again, there's important antibodies for COVID-19 in the breast milk that you don't want to waste and protect your baby with. As far as pregnancy and COVID-19, extremely safe. And all the data that we have so far from every study, phase 1, phase 2, phase 3, the vSafe data, and also some of my anecdotal data from looking at patients in the pediatric units and my coworkers who have been vaccinated. It's all extremely safe and does not cause infertility or anything like that.